So 10 years ago, I was leaving my residency program and I went to a meeting that was being presented about the Damon system, and it was Alan Bagdon was presenting Dr. Dwight Damon's system of orthodontics, the Damon system. And immediately I was intrigued because I liked the results that I was seeing. What I was seeing was these beautiful arch forms and these really nice developed smiles, differently than what I had seen in any of my residency program. And so immediately I knew, and I said to my father at that time, that we are switching the entire practice over to passive self-ligation. And passive self-ligation is a term for the types of braces and system that we use, which is the Damon system. I think the Damon system provides the best of all the worlds in the aspect of it is low force, so it's comfortable for the patient. Low forces equal faster results because they're biological movements. So we get better results, more comfortable treatment, and faster treatment by using great technology in our office. Yeah, we're excited about bringing the new iCat Flex into our office. The iCat is a 3D X-ray machine, and it allows us to look at patients with so much more information that we can really truly diagnose their bones, their soft tissue, their airways, and everything all in one simple picture with less radiation. The iCat is an imaging device very similar to a CT scanner, but this one is called a cone beam volumetric tomography device. We just call it the iCat. What's neat about that with that X-ray system is we're able to image a patient in 3 dimensions. And the reason that I brought it into our office is because not only are we able to see so much more in our patients and diagnose them better, but we're able to do it with less radiation than our traditional imaging. One of the really neat things that it does is it lets us measure their airway. And airways are the most essential thing to life, is breathing. And breathing naturally and breathing healthy allows us to develop those faces and those beautiful smiles that are stable. So that system really helps us do some really great diagnosis. Another thing that it does is it allows us to look at the joints. So we can look at the temporomandibular joint and not only understand that a patient has TMJ, but we can also understand why they have TMJ. And we can understand and track that we not only treat patients to a great smile, but we also treat them to a great position and a healthy position of their joints. So we have a new scanner in our office that we're pretty excited about too. You know, we're always forging technology, and one of the technologies that's coming forward is all this 3-dimensional imaging. Well, patients don't like to have the gooey impression trays put in their mouth. So today there is now a camera that we can use that takes a series of pictures and creates that dental impression without having the mold in their mouth. As an orthodontist, I think it's a super cool thing because we get to use it for our Invisalign patients, and we don't need to make the impressions in their mouth anymore. On top of that, it allows us the ability to communicate with all of our laboratories. So we're not taking impressions and pouring models and sending them via the mail. We're able to use this 3-dimensional technology and send it out over the internet to the laboratories. And so it's faster turnaround time, better communication, and more patient comfort, which is important.